As the world commemorates the World Tuberculosis Day, Nigerians have been advised to confront the monster before it turns to a dragon. These, according to Dr. Ayola Williams, can only be achievable through reporting to the right medical center for proper diagnosis when they sense any of the symptoms or sees anyone coughing for a long time. The theme for this year's World Tuberculosis Day is "The Clock is Ticking." Nwanne Ogechukwu tells us more in this commentary.
World Tuberculosis Day is commemorated annually to raise public awareness about the devastating health, social, and economic consequences of tuberculosis, and to set up efforts to end the global tuberculosis epidemic. The date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes tuberculosis.
World Tuberculosis Day is an opportunity for all hands to be on deck to fight this so-called tuberculosis. It's not a new name, it's not a new disease, but it has remained a menace, in the society. Since prehistoric time, tuberculosis is an infection that is caused by a group of bacteria that is referred to as Mycobacterium tuberculosis species, but the most important one of them is Mycobacterium tuberculosis. It's an infection that can affect any part of human body, and tuberculosis is a chronic infection. That is to say, it starts slowly, insidiously, and before you know it, it becomes something big, and that at the end of the day, if not treated, it becomes eventually fatal.
Historical data suggests that tuberculosis mostly affects adults in their most productive years. Over 95% of cases and deaths of TB are in developing countries.
Tuberculosis affects all age groups. In most parts of the world, it's commoner among people between the ages of 15 and 45. These are the people that are schooling. These are the people that are actively working in the nation. And so that is why eliminating tuberculosis is a fight that all of us must put our hands into.
The risk of infection can be reduced by using a few simple precautions, such as good ventilation.
Prevention of tuberculosis is not one man's job. It cannot be limited to the hospital or healthcare providers alone. It's everybody's job. Because the problem is, how do we find every single case of tuberculosis in the community? That's a challenge that we have. That's a challenge that we have. Because as long as there's one person in one community somewhere in Nigeria coughing, you continue to spread it. And we'll always have these cases.
In Nigeria, treatment of TB is provided free of charge at public facilities.
You know that in Nigeria, because of a lot of reasons, people present late to healthcare facilities. So this malaria is typhoid, before they find out that it's TB, most of the time they've not gone to a healthcare facility. You don't have to die from tuberculosis. It is no longer an untreatable disease if we detect it early and you take the appropriate treatment. So you may have to spend some money for other things, but those things that have to do with TB strictly, they have been paid for.
As the world commemorates the World Tuberculosis Day, it is important for everyone to come together and fight this monster before it becomes a dragon. Nwanne Ogechukwu, ACNN News.